The World Bank Group IMF meetings are virtual once more, and while our buildings are relatively empty when compared to past years,
you, connecting wherever you are, have more opportunity than ever to take part. For weeks, we've been convening and recording in-depth conversations with some of the world's leading experts on the most urgent development issues of our time.
Now, for these spring meetings, we're proud to bring you 4 events that will play out over 4 days and cover 4 important themes: economic recovery, debt, climate, and vaccines.
And while the main events are recorded, our subject matter experts are standing by live online right now to answer your questions and share your comments.
Hi, I'm Nejma Sher. As each event plays, my colleagues and I will be answering your questions in English, French, Spanish, and Arabic in the live chat at live.worldbank.org. And while you're here, please vote in our poll. There will be a new question every day.
And after each event, we'll be back here live from our headquarters in Washington, D.C. And on this socially distant set, we'll be putting some of the most popular questions that have come in online to senior World Bank Group leaders and experts.
So what are you waiting for?
Find all the details and share your perspective live.worldbank.org. And to have your say in today's event, use hashtag #VaccinesForAll. Now be sure to stick around after today's headline session. We've received a special message from Pope Francis, which we'll be sharing. We'll also have a live discussion with the International Finance Corporation's Stephanie von Friedeberg and the World Bank's Mamta Murthy answering your questions. And we'll be sharing the results of today's poll and much more. I do hope you'll join us. But now let's get started with today's session, COVID-19, Vaccines for Developing Countries, hosted by journalist Anne-Marie Diaz-Borges.
Good morning, good afternoon, and good evening to our viewers from around the world. And welcome to our final public event at the World Bank Group IMF Spring Meetings. I'm Anne-Marie Diaz-Borges, BBC Business anchor, and I am delighted to be your host for this flagship event, COVID-19 Vaccines for Developing Countries. A topic that is very much top of mind, as most of us have been affected in one way or another by this global pandemic. Personally, I felt the wrath of this pandemic as sadly my father passed away early this year. Who would have thought, little over a year after the World Health Organization declared the pandemic, that safe and effective COVID-19 vaccines would already be in use? Still, great challenges remain. While the rollout of these vaccines in developing countries is critical to protecting lives, building human capital, and stimulating economic recovery, the current crisis is exacerbating inequalities throughout the world. And without access to vaccines, the gap will widen further. Ensuring developing countries can access, as well as safely distribute vaccines, call for strong partnership and cooperation. Over the next hour, we'll be asking, how are developing countries preparing for large-scale rollouts of vaccines, and what gaps in access and distribution remain? How are the private and public sector helping to address the challenge? And how can efforts to address this crisis help us prepare for future pandemics? There are plenty of ways to watch. We're streaming this event in English, Spanish, French and Arabic on World Bank Live and across our social channels too. World Bank Live is also where our experts are taking your questions right now. You can share your comments at any point using the hashtag #VaccinesForAll. We have an amazing lineup of guests. Take a look at what's coming up. some really big names and big conversations to come. But first, we wanted to hear from young people who have been particularly affected by this pandemic. They've missed out on school and university, faced unemployment, and are often supporting family members, coping with mental health issues, and in some cases encountering gender-based violence. But they also have hope for a better tomorrow.
Nobody was prepared for the challenges that the COVID pandemic threw at us.
Virtual classes meant frequent power outages and all sorts of hurdles that posed as a difficulty to my learning.
Without the vaccine, obviously I'm a student, so meaning that my education is going to be gravely affected.
Because of Corona, 1 year has already gone by. If we truly want to change this notion of Nepal being a developing country to a developed country finally, I believe education is what will take us there.
Science's amazing achievement with vaccines will make me able to return to university and get that complete and thorough education I'm craving for.
I think in a developing country like mine, the biggest challenge would be, how do we first get vaccines to places where COVID has worsened pre-existing problems?
Our biggest challenge is to put in place a secure supply chain at national level.
Living in an archipelago consisting of over 17,000 islands can be very challenging, especially at times like this, where we have to mobilize vaccine distribution. Navigating logistics to remote areas in the country is one big problem that we still need to resolve.
Our biggest challenge facing vaccine distribution is fear driven by misconceptions. But me, I am not afraid. The vaccines are safe and effective and put us one step closer to restoring our world.
We will all be able to go back to how things were before this pandemic started. We will have social interaction without the risk of getting sick.
I'll be able to travel to my favorite places and spend quality time with my family. I can finally visit my grandparents and celebrate my grandmother's birthday safely.
That's good.
With vaccines, I can move about freely to class and dance in public.
With vaccines, things will change because it will help restore our lives back to normal and bring peace to our restless minds.
Hearing from those young people, you really understand how important, how urgent it is that global vaccines deployment is successful. It is now my pleasure to introduce World Bank Group President David Malpass to share his perspective on this vital work. David, over to you.
Thank you, Anne-Marie. The COVID-19 pandemic has taken a heavy toll on the health and welfare of billions of people, and its impact threatens to reverse a decade of gains in human capital. Access to COVID-19 vaccines will be critical for saving lives. We've made up to $12 billion available for vaccination programs. Together with partners, we've supported over 100 countries to undertake rapid readiness assessments, identifying gaps, whether with cold chain infrastructure or health workers. Where there are gaps, we must move quickly to fill them. Our projects aim to do this. To have enough vaccines for developing countries, we must address two things. First, we need more production. IFC, our private sector development arm, has $4 billion available through its global health platform to help manufacturers produce vaccines, support production of essential medical equipment, and strengthen health services. And second, we need greater transparency around contracting arrangements between pharmaceutical companies that develop the vaccines and their contract manufacturers to create opportunities for increased and direct flow of approved vaccines. Further strengthening of private-public cooperation is important to rebuilding and strengthening health systems. Throughout our COVID-19 response, we're paying close attention to the need to protect and invest in people. Investing in health, education, gender, and social protection helps build resilience when countries face crises, whether from economic downturns, pandemics, or climate change. As countries return to sustainable growth, they will continue to face intense fiscal pressures. They will need to prioritize smart investments in people that deliver dividends for the future. It's critical to get economies growing faster and to keep more families from falling into poverty. These steps and our partnerships together within countries and across regions and globally are the essential building blocks to a sustainable and inclusive recovery. Anne-Marie, over to you.
Thank you, David. We're going to be hearing lots of great ideas on distributing vaccines, but we want to know what you think. We're running a special poll throughout this event, and we're asking, what do you think is the most important factor in ensuring the fair distribution of vaccines? Is it A, increasing vaccine production to meet demand? Or B, overcoming logistical challenges in storing and transporting vaccines? Or is it C, building trust through education and awareness campaigns? Cast your vote at live.worldbank.org, and while you're there, there's also an opportunity to upvote your favorite question. We'll be putting some of those directly to two of the bank group's top experts at the end of this event, when we'll also be revealing the result of the poll. Let's now take a closer look at the work underway in developing countries to prepare for large-scale vaccine rollouts. I am honored to be joined by a truly top-level panel of experts. Dr. Tedros Adhanom Ghebreyesus is Director General of the World Health Organization, Henrietta Fore is the Executive Director of UNICEF, and Axel van Trotsenberg is Managing Director of Operations at the World Bank. Thank you all for joining us today. Dr. Tedros, to you first. As the head of the organization at the forefront of the pandemic, you have stressed the global solidarity that is needed to fight it. Could you share with us what you mean by that?
As you may remember, when I called for global solidarity, I used to also say, and I still say, national unity. So national unity and global solidarity are important. And I will start with national unity. As you know, if this pandemic is politicized, and if there are especially politicization at the country level, then the crack between the different political positions could be exploited by the virus. And we have seen that in many countries. So the first thing countries should avoid is politicization of this pandemic at the country level. Because if it's politicized, then it will exploit. The virus will exploit. And at the same time, if there is national unity, that's the basis for global solidarity. Because there is already a consensus at the country level that can also bring global solidarity at the global level. So coming to the global solidarity means, maybe in simple terms, it could start from sharing information, information about the outbreak so others can understand. It could be sharing the pathogen so others can use the pathogen to produce, technology. Then when technology is produced, it could be sharing technology, like vaccines, for instance. Sharing vaccines is solidarity. And not only that, solidarity means working together also, collaborating, coordinating the response together. But to be honest, since the pandemic started, the solidarity and national unity have been really not as good as one would desire. So even going forward, I think we need to still advocate for global solidarity, because the virus will not be defeated in a divided world. We need to share everything that we have in order to defeat this virus. And the sharing or supporting each other is not charity for me. It is actually in the best interest of each and every nation. As you know, the virus is changing quickly. We have mutation going on, and we have several variants actually coming from different countries. If the change in mutation of the virus is significant enough, if the behavioral change of the virus is significant enough, even the vaccines we have now may not work. So if you take one aspect of solidarity, sharing technology or vaccines, unless we increase the coverage of vaccines quickly and defeat the pandemic, the virus will get a space to continue to spread, circulate, and then mutate. Then you have more variants. And even those countries who have high coverage of vaccines will not be secure, because the new variant that may not be stopped by the vaccines we have will invade the countries who may have even 100% in few months with the existing vaccines. So it's in the best interest of all of us. Thank you.
Thank you. Thank you very much. Now let's turn to Executive Director Henrietta Fore. Henrietta, there are certainly many issues and challenges in terms of vaccines. Please tell us, what is UNICEF's position on those challenges at the moment?
So, Anne-Marie, one of our challenges is financing, and the World Bank has come forward with IDA financing. It makes a big difference in country readiness, in the procurement and the delivery of these vaccines, and a replenishment is coming. This will be critical for us to be sure that we are able to reach the poorest countries in the poorest areas. So World Bank financing makes a difference. It is part of this global solidarity approach that Tedros was just speaking about. So for a UNICEF that is on the ground and in many, many countries, this is important. So UNICEF usually is procuring vaccines that are routine immunizations for children, things like measles and polio and other vaccines necessary for a child's health. This is usually about 2 billion vaccines a year. Now we are procuring 2 billion additional vaccines for COVID. It is a massive procurement and supply operation. And with the World Bank and WHO, we do country readiness assessments so that there are national development plans and they can prioritize where these vaccines should go. But this enormous undertaking means that you need lots of pieces in the supply chain. So after we are able to procure the vaccines and deliver them to the countries, it's very important that countries are ready for them. So we've been working for years on cold chains, but this COVID time period has really tested the cold chains and how cold our chains are. We also need to work with the ministries of health, preparing and training the healthcare workers. Every vaccine is different, and you need to be sure that the workers, the healthcare workers, the front lines have personal protective equipment, but they also have the knowledge to know how to do the vaccination campaigns. Then we also have a great need, which is communication to populations. So every population needs to know that vaccines work, that they are safe, so that people do get vaccinated. And this is an important part of building trust in societies, and it is important for every country. So there's many pieces to the puzzle, but country readiness is very much on our mind, and it is what we are working toward. Big undertaking, lots of partners. We do it with the World Bank and with WHO, but we're out there to help children and their families.
Thank you. Allow me to turn now to Mr. Axel van Trotsenburg. Axel, getting vaccines to developing countries is the first hurdle. Then, as vaccines arrive, there are many more hurdles getting the vaccines where they need to go before ending up reaching the people. How is the bank supporting countries on those two fronts?
Well, let me go to the first hurdle. As Tedros correctly said, we need international solidarity. But I would add, actually, we need to add fairness and urgency. Fairness is that all the developing countries, particularly low-income countries, have access to the vaccines. This is currently not the case. And this is a huge concern to all of us who are sitting. Tedros has been calling for it, Henrietta have been calling for fair distribution of vaccines. We need to reserve a certain amount of the installed capacity for low-income countries. Otherwise, there is a huge risk that they will be left out and only getting the bulk of the vaccines next year. There's urgency to act. We cannot wait. We have to keep on that urgency. And I think this is certainly from the UN system to the World Bank, I think we are pretty much unified that this urgency is needed. Then we need, of course, the money. I think we have made available $12 billion for vaccine and the deployment of the vaccines for middle-income and low-income countries. And I think by the end of April, we should have committed about $2 billion. We're working with 40 plus countries on this. But as I said before, the money is great. But if you don't have the vaccines, then we have no results. So again, go back to urgently fairness and deployment that it needs to be. On the deployment, I think there has been a very effective and good cooperation with all the agencies helping developing countries. This is the WHO, that is UNICEF, that is Gavi, that's the Global Fund, that is a regional organization like PAO in Latin America. What we need to look is at the readiness assessment. I think we have done thus far together about 140. And you see various degrees of readiness. And therefore, what we are doing in our operations in coordination with the WHO or UNICEF to see how we can support countries in the effective implementation. This will be a continued effort on this, as well as that we need to monitor that it is correctly implemented. WHO has established a very useful priority list who deserves first the vaccines. We strongly urge countries to follow that advice so that indeed the most vulnerable gets first the shots, and then you work your way down. What clearly is needed, and this is that we don't see this readiness assessment preparedness as in isolation, but there has to be also medium-term healthcare or health system strengthening, and this is the longer-term agenda on which we all have to work.
Now, coming back to you, Dr. Tedros, what are the main bottlenecks when it comes to vaccine deployment and manufacturing? How do we address this at global, regional, and country levels?
Yes. So the first, thank you. I mean, there are many bottlenecks, but the first bottleneck is many countries, they have this narrow nationalism rather than enlightened nationalism. That's why they're moving into vaccine nationalism. And meaning the bottleneck here is lack of political will. I think it's better to say it openly. If the major countries agreed to solve this problem, to address vaccine equity, they can do it. They have everything. They have everything to do it. So the political will is missing. Then, of course, if you move into other issues with regard to manufacturing, one is, there is excess capacity to fill and, finish. We're not using that. So we have to identify companies who have excess capacity to fill and finish. The other is voluntary licensing. And there are, companies, hopefully, who would be willing to license their patents or to transfer their patents voluntarily and to a specific company that they want. Of course, there is some compensation to what they can ask, but that's the second one, or immediate. The third is, as you know, we have what we call CTAP in WHO. It's a coordinating mechanism to pull patents and use it, as a means for technology transfer. So that's one bottleneck that they're not using, although we have the mechanism, but it's not being used. The fourth is lack of use of the waiver in the intellectual property, in the TRIPS for intellectual property. That's actually the elephant in the room. That's one major bottleneck. As you know, the provisions in the TRIPS agreement was made to waive IP, intellectual property, during emergencies. We haven't seen any emergency like this in our lifetime. If we cannot use it now, then when are we going to use it? So these are the major bottlenecks, but the mother of all these bottlenecks is lack of political will, and even to the first question, weak solidarity, weak global solidarity. Thank you.
Thank you very much. Now, Henrietta, we hear that women and children are bearing the greatest brunt of the pandemic. How differently are women and children being impacted?
So, Anne-Marie, you are right. Women are often the primary caregivers, both as healthcare workers, but also at home. And as a result, they are really torn in every direction. And what happens is that women, their participation in work, in paid work, is reducing around the world. It's in decline. So we are concerned about women and their employment, and we are very concerned about all of these services that women and children usually access in their normal lives. They're either not able to get to them or the services are not available. So as Axel and the World Bank have been talking about world poverty, we have another 140 million children that are likely to fall below the poverty line with their families. 168 million children have been out of school for more than 9 months. 1 out of 3 children do not have access to any form of remote learning. And you know, now, Anne-Marie, many children are getting their lessons online, either through a cell phone or a tablet or through a radio or television. And it's very important for children to keep getting these services, but it's not always available. And so often it is the woman in the household who becomes not just a parent, but a teacher. And then it is very difficult for her to then be out of the home and holding down a job. We're also very worried that many children will not come back to school, and it's particularly girls. So once girls are out of school, parents often think that they could help their elders in their family and look after them. That maybe child marriage would be safer for them, but it means that for every 2 boys returning to a classroom, maybe only 1 girl will return. So we're concerned about all of these services. It's having an enormous impact on women and children, and we cannot trade one crisis, the pandemic, for another crisis in which we lose the women and the girls and the children in our world.
And Axel, beyond addressing the ongoing health emergency, what advice are you giving to the countries in which you operate today in terms of being better prepared and increasing resilience for future crises?
So Henrietta powerfully summarized the effects this crisis has had and on women and girls, but actually one can say on whole societies. We are making seeing an enormous reversal on the progress that we have seen over the last couple of years. So what is clearly is that we need to focus more on crisis preparedness. I think this will be a prominent topic also during the upcoming negotiations for the IDA 20 replenishment. We have been actually working on that, particularly as it pertains to natural disasters, but also we started also with pandemic as a result of the Ebola pandemic. Nevertheless, what we are seeing that very often this preparedness plan were on paper tigers, if you wish. They were nicely drafted on paper. What we have to say is we clearly need to embed it into the health system. And ultimately, we need systematic health system strengthening. This is hard work. The cameras won't be there, but I think it is the absolute necessary part that we have to do. We also should not only take a narrow view on that it is only health, it is the whole agenda best summarized with the SDGs, that we are not making progress on this. Education is a point, but in many, many other areas. So our concern is that we have to build back better, stronger, learning, and we need to keep the solidarity, not only in the health area, but across the development spectrum, and that only this crisis has shown only together we will survive, only together we will strive, and only together we will prosper.
Thank you very much. Only together we will prosper. On that, I'd like to thank all of our guests for this enriching discussion.
Merhaba, I'm Damla Er in Istanbul, and you're watching World Bank Group IMF Spring Meetings.
Successful global deployment of a vaccine will have an enormous impact on so many aspects of our lives. Let's remind ourselves of the difference it could make. Now let's hear from two organizations working on the front lines of the vaccine rollout. Executive Director of Global Programs at Save the Children UK, Gwen Hines, and Head of COVID-19 Crisis Management for the International Committee of the Red Cross, Esperanza Martinez.
Vaccination for all is entirely possible if we work together. We've made enormous progress over the past year on vaccine development, but none of us are truly protected until all countries have COVID under control. And the costs of not doing this are going up every day. For the first time in 30 years, progress on child poverty, hunger is going backwards. An entire generation have had their learning disrupted, and millions of children, especially girls, will never go back. So we need to act now. And for those who say it's too hard to reach the last mile, I can tell you it's not. We do it already with measles vaccinations, with meningitis. We work on Ebola with local communities. So please get behind the COVAX initiative with money, donating surplus vaccines. Share technology and know-how. Invest in scaling up production in low and middle income countries. And most of all, commit to the principle that we should be vaccinating all vulnerable people without discrimination, wherever they live. Thank you.
I am sure that vaccination for all can happen if we put aside borders and politics and focus on our shared humanity. We need to make sure that everyone, disregarding who they are and where they live, have access to vaccines, not only for COVID-19, but also for other preventable diseases that every year cause so many deaths and so much disability. We also need to make sure that healthcare workers and vaccinators can carry out their jobs without being attacked. And we need to remember finally that there are millions of people facing humanitarian crisis today, and their needs also need to be met. My hope, my wish for 2021 is that we collectively demonstrate that we can deliver, both in the humanitarian space and in the vaccine space. Thank you.
If you've just joined us, welcome. I'm Anne-Marie Diaz-Borges, and we're discussing the rollout of COVID-19 vaccines for developing countries. And a reminder that you can share your comments at any time using the hashtag #VaccinesForAll. Now, Gavi is a global vaccines alliance and a key partner in COVAX, which is at the heart of the response to COVID-19. I am delighted to be joined now by the Gavi CEO, Dr. Seth Berkley. Dr. Berkley, welcome, and thank you so much for joining us today. Could you explain how COVAX helps low and middle income countries get access to COVID-19 vaccines?
Thanks so much for the question. COVAX was set up to try to accelerate the development and then the access of vaccines for every country in the world. But of course, the main thing we're focusing on here is the work we did to try to reach lower middle income countries. We created the Gavi Advanced Market Commitment to serve the 92 lowest income countries and to bring a very large portfolio of vaccines to them. That was necessary because we knew that there was going to be intense competition for vaccines, and therefore we had to make sure that those vaccines would be available. We've now delivered more than 30 million doses to 60 countries. And although it took us 43 days for the first vaccine to be used, that is much better than in the previous pandemic of swine flu, which occurred now about a decade ago. As you know, your country, Cabo Verde, received its first doses of the vaccine on the 12th of March. And although we obviously have many more countries to go, each country does really celebrate when this happens. It's a great moment for global health, for the countries that have worked to build up their systems, and of course for the people who receive this vital protection.
Thank you so much for mentioning my country there, my dear country, Cape Verde. That first dose of vaccine was such a source of celebration for the whole country, so thank you for mentioning. Dr. Berkeley, how confident are you that low and middle income countries will be able to vaccinate at least 20% of their populations by the end of this year?
So the first step, of course, in doing this is having adequate finance. Donors have been very generous. We've raised $6.3 billion so far, and we're hoping to get another $2 billion by June. We've been really working hard to overcome all of the problems in supply that you've heard about in the media. And through our diversified portfolio, we're on track to deliver 1/3 billion doses by mid-year and then 1.3 billion doses by the end of the year so that countries can protect their most vulnerable populations, including healthcare workers. Of course, we believe that countries, and they want to go to a higher amount of the population than that. So we think that if we get adequate finance, we can actually get to 1.8 billion doses by the end of the year. Of course, there are still questions on whether we just want to linearly increase the amount of vaccine, or will we need boosters or different vaccines for the new variants? And of course, these questions will have to be resolved.
And what are the main challenges and opportunities that COVAX is facing in delivering vaccines to low and middle income countries?
Of course, during this moment is an unprecedented time. We have to get to large amounts of the population. To be able to do that, we had to create new systems to deal with things like indemnification and liability, to create a new no-fault compensation scheme, since there wasn't adequate time to deal with the normal ways of dealing with those type of problems. We've also had to work with countries to be able to develop their delivery systems to make sure they were able to move these forward. These types of interventions are really important, but what we're hoping is that we can build them sustainably so they will be there in the future to be able to deal with these systems. At a time when there is an unprecedented demand for vaccines, we also have to work to make sure that manufacturers will keep to the deals they make and make sure that these vaccines are available.
Dr. Berkeley, this has been a pleasure. Thank you so much.
Thank you. Nice to talk to you.
Ngaramutse, I am Sandrine Nina Hadre in Bujumbura, Burundi, and you are watching the World Bank Group IMF Spring Meetings.
Now, frontline workers and community leaders have been celebrated as the true heroes of these times, risking their lives to protect ours and helping educate, distribute, and deploy vaccines. Let's hear from some of them now about the challenges that they face.
One of the biggest problems we are facing is equitable access. I believe that every healthcare professional in every part of the country deserves access to the vaccines.
No country can do it alone, so cooperation, especially in the case of vaccines availability and distribution, is key.
And one of the major issues with distribution in my country will be people rejecting the vaccine, the fear that people are harboring due to the theories they've heard, due to fears of complications associated with the vaccine.
Misconception and miscommunication and misinformation among the general population.
So probably more education may have to go into the vaccine distribution.
На мой взгляд, на сегодняшний день в социальных сетях и очень много разной информации, по большей части недостоверной информации про вакцинацию.
By vaccinating against COVID-19, we will be making an effort together to fight the fear we have been living with in the past year.
We are stronger, more experienced, and united.
Vaccination will expedite a transition towards our normal, happy life.
Vaccines are going to change my life because my patients will get to see my smile again because I don't have to put on a mask.
It means a new start. It means a second chance. It means that we all face a pandemic. We must be grateful to be alive. That means value life more. Because as we know, it can change in a blink of an eye.
So humbling and helpful to hear those perspectives, and a timely reminder of the challenges that we must overcome together in order to successfully deploy COVID-19 vaccines and get this pandemic under control. It's clear that this challenge cannot be resolved by any one player alone. It will take partnerships across sectors and fields. So how can the private sector best contribute? That's what our next guest will help us explore. Jérôme Thiel is Deputy CEO of Cerba Healthcare, which manages an international network of clinical diagnostics laboratories and is active across sub-Saharan Africa, where its labs are proving a key resource for much-needed large-scale testing for COVID-19. And Maktar Diop, Managing Director of the bank group's private sector arm, the IFC. First to you, Jérôme. I understand that in 2019, Cerba significantly expanded its presence in Africa. Can you talk to us about what Cerba is doing to help expand testing in developing countries for COVID-19 and other pandemic fighting steps?
Thanks, Anne-Marie. Indeed, Cerba has a long history of providing specialty testing for African private and public labs from its historic lab in Paris. Based on a long parallel partnership with Lancet Laboratories from South Africa, where we deal for clinical trials and central lab in this country, we decided together in 2018 to create a joint venture, Cerba Lancet Africa, to operate and expand network of proximity labs to provide African population with high standard quality testing at affordable cost. As a result, we are now present in 13 countries with more than 70 labs, 1,500 employees, and serving more than 1.5 million individuals. When the COVID crisis arrived in Europe last year, we were immediately and very intensively asked to fight against the response to this crisis with developing a lot of PCR testing. Simultaneously, we anticipated the outbreak and the spread of the outbreak in Africa and liaised immediately with our teams on the ground to develop a war plan in order to be able to propose PCR testing solution to populations and authorities. Thanks to the dedication of our colleagues on the ground and the support from the group for technical aspects, scientific and also procurement issues, we have been able to install some PCR platforms in most of the countries where we operate. And since then, we have done more than 300,000 PCR tests. We invested on our own more than 2 million during this moment. I think that our value added into this project is clearly to have a local presence and to access rapidly to the population. We also serve the medical communities with efficient diagnostic in this field, with the appropriate turnaround time, also with an efficient pricing and full transparency for authorities. In the COVID pandemic, we can also help in through our local facilities and trained staff to boost vaccination. And obviously, this model can easily be replicated for unfortunate other pandemics that may occur.
So one of your aims there to really strengthen your local presence. Jérôme, can you now tell us what other opportunities you see for the private sector in helping countries meet the healthcare needs of their population more broadly?
So you're perfectly right, because we think that the private sector, and specifically the long-standing players, have a lot of experience and capabilities to help improve the sanitary sector and system in Africa. First of all, we are convinced, and we have proven in more developed countries, that diagnostic and prevention is absolutely crucial to rapidly and with moderate financial cost improve the access to healthcare for the population and also control the pathologies development. Second, as I already mentioned, the private sector has a presence on the ground with easy access to patients, which are key into any sanitary policies. We have a dense network of collection centers, and we also develop a lot of new solutions such as point of care or mobile units in order to expand this presence. Third, we also have access to robust and innovative scientific and technical solution to provide the high quality diagnostic to the population. We also have very well experienced and trained teams to find also the appropriate solution for patients. As a private companies, we are used to invest and to develop adapted solution, provided we at affordable cost, obviously, provided we have a stable and quite transparent regulation environment. As an example, Cerba runs more than 200 labs worldwide for hospitals, either public or private institution. And finally, and I think it's important, we invest a lot in training, which is key to increase the sanitary awareness of the populations. At Cerba, with our in-house Cerba University, we have a pluriannual plan to train most of our colleagues in Africa. And also, perhaps, I think it's something we will expand later on, the private sector could also work with the local public authorities in the development of vaccination for the COVID outbreak.
And now to you, Maktar. We have heard about the challenges of getting the vaccines to people in developing countries. From your vantage point, leading IFC, what's the role of the private sector? And Jérôme, I think, will be very interested in knowing. So what's the role of the private sector in helping countries meet their goals?
Thank you very much, Anne-Marie. The role of the private sector is multiform. First, on innovation, production, research, R&D, on vaccine is done from the private sector with the support of the public sector, but a lot of the development are done by private companies. So this is an important part. The second one is the logistics. One thing is to produce the vaccine, to have the research, to have those in place. Another thing is to have them in the arm of the citizens. So all the logistics part I've seen recently in advanced countries is a big challenge. And the private sector can play a big role in helping and using new innovative mechanisms to be able to deliver those vaccines to the population. The third element is to help building a resilient system. We know that we had an outbreak like this. I was a vice president for Africa when we had the Ebola crisis, and I've seen firsthand how this crisis also, an epidemic, has a huge impact on economic development in Africa. We have a crisis of a larger magnitude now, but what is so is that for lots of developing countries, the health system is not resilient enough. So what we are doing is, as we are working in addressing the short-term needs, we are also working towards helping building a much more resilient system. It means that we need to think not only about private sector as an agent of building infrastructure for health services, but also to be a service provider and change totally the model whereby the public sector doesn't necessarily have to invest heavily in infrastructure, in equipment, but to buy services from the private sector to be able to do testing, to do X-ray, to do a certain number of things. Lastly, how to strengthen the value chain. The value chain, the production chain is important to strengthen. We realize that in some countries, not only they don't have vaccine, but they don't produce syringes, they don't have swabs, they don't have equipment. We are partnering with support of our donor countries to put in place a system where we can be using the textile industry more efficiently to be able to produce garment and equipment to protect workers. So there are many dimensions to what we can do to support the health system and make it much more resilient and responding also to the short-term crisis.
And Maktar, it is clear that solving critical health needs, such as around COVID-19, requires partnerships and innovation. What is IFC's strategy here?
We have, our strategy is to build on the effort of government. For instance, recently our public sector branch, the World Bank, provided a loan to Cabo Verde to face the COVID crisis. But also we would like to build on this to build a resilient system. So what are we doing and what can we do to accelerate it? We need to ensure that the regulatory framework is strong enough. When we see the very sensitive sector where this investment decisions are not easy to take and have a long-term, sometimes a payback period, and have a long-term a financial decision which have long-term implications. So we need to have much more certainty on the environment for investors to be able to come, and Jerome alluded to it. So our public sector part of the World Bank is working to help government strengthening the regulatory framework so we can crowd in private sector. Secondly, we want also to bring the local private sector to look at also the pharmaceutical industry to be able to invest it. So it will be not only FDIs, it will be FDIs, but also local investors who will be more and more looking at this sector as being a sector in which we can invest and have a high return. The third element is investing in skills. This is in those labs that you mentioned, you require very well-trained and very specialized people. So we can use the private sector, as Jerome mentioned in his company, to train academics, to train researchers, to train health workers to be able to use that equipment, to do the research, but also to combine those services with what the government is doing to be able to support. So it's clear that here we are talking really about a joint effort between government and private sector, and the space is huge. So there is space for both private sector and public sector to do more, because medical needs in least developed countries are huge and very important.
So it will truly require a joint effort there. And with that, I'd like to thank you both for such an important and enlightening discussion. Merci beaucoup.
Merci beaucoup, Anne-Marie.
Hello, Luyumi, everyone. I am Leisande in Port Vila, Vanuatu, and you're watching the World Bank Group IMF Spring Meetings.
If you've just joined us, I'm Anne-Marie Diaz-Borges, and we're discussing the rollout of COVID-19 vaccines for developing countries. I hope you've already learned something new, and for those interested in diving even deeper, we've pulled together some key fact sheets and blogs. Just scroll down to the resources section of our World Bank Live page. And while you're there, cast your vote in our poll. A reminder, we're asking you, what do you think is the most important factor in ensuring the fair distribution of vaccines? Is it A, increasing vaccine production to meet demand? Or B, overcoming logistical challenges in storing and transporting vaccines? Or is it C, building trust through education and awareness campaigns? We'll be sharing the results live at the end of this event, so keep watching. As this poll highlights, effective delivery and health systems are an important part of vaccine deployment. Let's take a closer look at this challenge and at how the World Bank Group has been responding.
Many vaccines need to be kept cool. Some need to be kept cold, very, very cold. From factory to patient, they need to be refrigerated in warehouses, trucks, planes, cars, even motorbikes. And that's just one small part of a vast, interconnected health system. That's why the World Bank is providing $12 billion to equitably distribute COVID-19 vaccines, with priority for those that need it most urgently, and strengthen the health systems that deliver it. Train and equip frontline health workers in cities, suburbs, and rural communities. Support health centers that care for patients, but also collect and share information to identify hotspots or have insight into where infections could flare up. And make sure there is equipment, training, financing, and more to be prepared so the next disease outbreak isn't so devastating. Just focusing on COVID doesn't make an effective health system. Preventative care for people must continue, especially for women and children. Life-saving treatments for chronic conditions must continue. Other health and medical needs don't just go away. And outreach is especially important. From past vaccinations, we've learned that we need to inform people and battle stigmas, misinformation, and distrust. Vaccines, testing, and treatment are vital to turning the tide against the pandemic, but improving health systems will rebuild livelihoods and economies, and hopefully make healthcare better than before.
Let's turn to our final discussion and look at what can be done now to learn from this crisis to help developing countries respond to the next pandemic. Are there lessons that could strengthen resilience and help countries better prepare for future shocks? I'm joined now by a truly esteemed panel. Ngozi Okonjo-Iweala is the Director General of the World Trade Organization. Dr. Richard Hatchett is CEO of CEPI, which stands for the Center for Epidemic Preparedness Innovations. Dr. Gro Brundtland is the co-chair of the Global Preparedness Monitoring Board, former Prime Minister of Norway, as well as former Director General of the World Health Organization. And Mari Pangestu is Managing Director of Development Policy and Partnerships at the World Bank. Welcome to you all. Ngozi, first to you and congratulations on your new position as head of the World Trade Organization. You were selected to head the WTO in February of this year, almost 1 year after the pandemic began. What do you see as the greatest economic impacts that developing countries are bearing during this global crisis?
Well, thank you so much, and thank you for congratulating me. Let me just say that before we talk of economic impact, we have to look at the health impact, because the biggest thing for economic recovery for developing countries is getting the vaccines that they need in order to deal with the pandemic. I often say the biggest economic stimulus for developing countries would be access to these vaccines. So that's the first. But developing countries have been hit in so many ways. Commodity exporters have faced plummeting prices. Travel and tourism for those countries that depend on this has collapsed in many countries. And even those well integrated into global value chains, they've suffered from some of the closures of factories and borders and so on. So there's been a lot of impact on developing countries. And as you can see, for 36 years, poverty has been declining. From a figure of about 3 decades now, poverty has been declining. And In 1990, 36% of people were living in extreme poverty. Now, in 2018, this fell quite substantially to about 10%. And now, for the first time, it's climbing back up. And the World Bank projects that 150 million people could fall back into poverty. So you can see how the impact of this has really been very dramatic.
Thank you very much. Thank you very much also for reminding us of the issue of poverty, which, definitely needs to be mentioned here as well and linked to the pandemic, especially when we're talking about Africa. Now, Dr. Hatchett, CEPI is an organization that helps finance research in global public goods, such as vaccines. Can you explain the role that CEPI has been playing during this pandemic?
Thank you. We've played an evolving role, actually, in the first stages of the pandemic. Last January, February, March, we played an important role in initiating vaccine development programs. We actually established our first partnerships on January 23rd. There were fewer than 700 cases of COVID globally at that point. And we've ultimately established one of the world's largest portfolios of COVID-19 vaccines. Since last spring, we've also been focused intensively on ensuring access to those vaccine products. We used our investments in innovation and R&D to create access commitments for our partners who would then provide that vaccine into what became the COVAX facility, which, of course, I think everyone is aware is a facility for procuring vaccine and delivering it to all participating countries, but particularly to those countries, the impoverished countries that would not otherwise have access to vaccines. Finally, in the last few months, we've begun to focus on continuing our R&D investments, but thinking about making sure that the world has access to the vaccines that it will need to manage COVID in the long term and to address the emerging variants that have given so much concern recently.
Thank you very much. Allow me to turn now to you, Dr. Brundtland. You are now co-chair of the Global Preparedness Monitoring Board, which in 2019 warned that we were a world at risk. Last year, in the midst of the pandemic, you came out with a world in disorder. Where do you see us now?
Well, we have a world of contrasts. Vaccine production has provided hope, but trust in global leadership has been eroded. Our weak global structures and systems for preparedness have been exposed. In our reports, we recognize that equitable access to COVID-19 vaccines should be a crucial issue. It's a moral imperative, it's a public health imperative, and an economic imperative. The rapid development of vaccines for COVID-19 has been remarkable, but it is all the more devastating that while science has advanced, the world has stalled in terms of equity. The poorest countries are seeing virtually none of the benefits of COVID-19 vaccines. We are stuck where we have been for 30 years, reliving the unequitable responses to previous emergencies. The board called for the initial production of COVID-19 vaccines to be allocated equitably to all countries to ensure each country had enough vaccines to cover 2% of its population for health workers and the most vulnerable. This means around 300 million doses. 475 million doses have already been allocated, yet the large majority of lower income countries have vaccinated less than 1% of their population. And many of the poorest countries have yet to receive a single dose. The lack of global mechanisms for vaccine development and access are at the heart of the problem. We have well-established systems for research and development which rely on the incentive of IP and competition. Securing access to countermeasures has been based on advance purchase agreements. Access to countermeasures by lower income countries have depended on donations and development assistance, relegating them to the bottom of the list. vaccine delivery continues to be determined by economic power, production capacity, and competition, rather than public health and unacceptable failure of global preparedness. And I say this despite what has been done by CEPI, which is very helpful, but not enough.
Thank you very much. So a world of contrast, very strong words there and so befitting, absolutely, to what we are witnessing at the moment. And now to Mary Pangastu. Mary, the World Bank plays an important role convening global institutions and countries. How are partners coming together at the global, regional and country level to address the and prepare for the future?
I'm glad you asked that question. The World Bank is working with many partners, and I think this has been an incredible example of partnership, starting from preparing all the way to delivery. We are working with WHO, UNICEF, Gavi, Global Fund, and the Gates Foundation. So starting from the technical and conceptual level of how do you design the readiness back in the middle of last year. And then in November, there was an agreement of how would you design a vaccine readiness assessment framework, which can then be tested on country, which will then be applied at the country level. And this was agreed in November. And we also agreed that we would roll out readiness assessments in 100 countries in 100 days. And we actually did it. And that was a partnership, so a partnership in the design and then partnership in the assessment at the country level with all those partners on the ground. Of course, working with the countries and assessing their coordination and their planning, their targeting, their cold chain infrastructure readiness, the workers, the communication, the regulatory aspects. And that readiness allowed us to assess the gaps that existed in countries and therefore the financing that was needed. And then the partnership came in again on the co-financing, whether it's bilateral donors, regional development banks, multilateral development banks, grants, and how much the country also had resources. And then on the access for vaccines, fair and equitable access, of course, we work with COVAX to provide the first 20% of delivery and also work with countries on other access for above the 20%. And then finally, working with countries to develop their national deployment and vaccination plan on the ground and supporting them. And at the same time, looking out as to how they would also build out and strengthen their health systems at the same time. And the World Bank works very closely on the ground with UNICEF, with WHO, and other partners, and also, of course, with the countries themselves.
Thank you very much, Amari. Going back to you, Ngozi, following up on what we've heard and going forward, how can we strengthen the global economic architecture to better prepare against future shocks?
Well, thank you so much. I'd like to make 4 points on this. I think that the first is that we should have a better preparedness and response system in place. And when I talk about preparedness, I'm talking about surveillance and early warning systems, whether we are talking of pandemics or diseases, or whether we are talking even of climate change related kind of disasters. The world needs to invest in surveillance so that we can get early warning. So that's the first. I think the second point is that we should put together a financing framework that would help us deal with finance both the preparedness part, but also finance the response in case we don't get the warning on time. And what is very difficult now in the world is the fact that preparedness is probably a tiny percentage, maybe 1% of the monies we spend on response. If you look at the trillions of dollars we spent in this pandemic, just responding to the health and economic issues, if we had spent maybe 100 or 200 billion on preparedness before that, we would have been better off. So we need to put together a sensible financing framework. And I think that the third point I'd like to make is that we need to keep supply chains open. Of course, coming from the trade side, I would say that. But we've seen that trade has helped us manage this pandemic and has made the economic impact perhaps better able for governments to handle than it would have been, even the health impact, because we've been able to move through trade, medicines, vaccines, PPEs from one country to the other. So keeping supply chains open is a very important part of the response. So those 3 points I think are vital for us to be better prepared next time and safeguard our economic systems better.
Thank you very much. And when it comes to supply chains, we have seen how much Africa has suffered in many a time. So thank you very much. Now, back over to you, Dr. Hatchett. What do you see as the most pressing priorities for CEPI as you continue to support the development of vaccines for this particular pandemic, but also for the accelerated development of vaccines for future pandemic outbreaks?
Thank you. First, I think we need to build on the accomplishments and the improvable models, really both technical, institutional, and operational that have emerged from the pandemic. We have compressed a decade's worth of technology into perhaps a year. We will emerge from the pandemic with new tools that will allow us to prepare for the future. We have laid out the model with COVAX and the ACT Accelerator that are improvable. They're not perfect. But they lay the foundations for future institutional responses. CEPI as an organization has now laid out its own plans for the next 5 years for what we're calling CEPI 2.0 that would entail investment of about $3.5 billion. It would focus on strengthening our defenses against COVID, certainly, trying to take coronaviruses as a threat class off of the table, developing vaccines as we were prior to COVID for known threats like Lassa, MERS, Nipah, Ebola, working to compress vaccine development timelines. We delivered licensed vaccines this time in 326 days. We'd like to shorten that to 100 days, building a library of prototype vaccines that would enable us to respond rapidly to any future threat, establishing global networks for clinical labs, assays, clinical trials, and finally supporting the efforts of low and middle income countries to provide for their own national health security.
Thank you very much. It's true that this pandemic has truly been a period of very rapid innovation and development of so many different new technologies, like you've just mentioned. Going back to you, Dr. Brundtland, what do you see as the most crucial gaps that the global community needs to address to help ensure we are better prepared for future health crises?
Well, the start of the current pandemic revealed shortcomings at all levels. We need an international agreement in place to support and strengthen our international institutions, the WHO, the international financial institutions, in order to deliver on such an agreement. Ultimately, the success of an international agreement on pandemic preparedness and response will rely on money. We now need to address the historic underinvestment in preparedness. Investments have represented a fraction of what is required. Funding in millions, what should have been in billions. The board estimates that an additional annual investment of $5 per person will be needed. With the trillion spent on the COVID-19 response, as we just heard from WTO, we are paying the price for past sticking plaster funding. Now we need to fund future preparedness at the scale required. We must develop appropriate funding and financing mechanisms for preparedness, which do not rely on ODA and are predictable and sustainable. The board quickly realized there was a lack of mechanisms to finance global public goods. This must be addressed urgently. In particular, I want to challenge the World Bank to develop a mechanism to remedy the present inequity in vaccine distribution. This future mechanism should be based on agreements with vaccine producers and on pre-commitments from lower and middle income countries. It should provide upfront financing of vaccines to IDA eligible countries so that vaccines arrive at the same time as they do in higher income countries. The ugly truth is that at this stage of the COVID-19 response, we are seeing how money talks. In the absence of appropriate global financing structures, resources are flowing to the rich. We will all pay the price in terms of economic damage, global instability, and a prolonged pandemic. The world was unprepared for this catastrophe. Unless we change our systems for financing and allocation of global public goods, we will face the same problem in the next pandemic. So I call on you to ensure that this does not happen.
So money, the heart of the issue here, like it is often the case. You've mentioned preparedness, just like Ngozi had as well. So we need to pay attention. Thank you very much. Now, going back quickly to Mari. Mari, you've talked about the important role of global partnerships to address health emergencies. How is the World Bank supporting countries as they prepare themselves for future emergencies?
I'd like to make 3 points to answer your question. I think first, we're learning a lot as we are responding to this pandemic and rolling out our program. As I mentioned earlier, we already have vaccine readiness assessments in 144 countries, and we're already deploying almost $4 billion in around 11 countries already, and then another 40 countries in preparation. So we're learning a lot as we're doing. So the 3 things I would mention on what we've learned. First, that as we are rolling out the response to the pandemic, we must not forget some of the priority health issues, such as making sure that health services for women, maternal health care, and so on are not, and children immunization are not put by the side as you are responding to the pandemic. So, that's one area of key importance. Second, as we are rolling out our program, we're learning a lot on the ground as to how you can actually, as you do your preparedness, also build out for a medium-term strengthening of the health systems, whether it's the infrastructure, whether it's the training of the health workers, and a very important role of technology, the possibility to have information on those getting vaccinated, monitoring it, and so on. I think this can really be important for the future to prepare yourself for the future pandemic. And many things that we learned on the ground can be helped to be used to help develop the stronger systems. And thirdly, I think to Dr. Brundtland's point about manufacturing capacity and supply chain, I think we're also learning a lot about that. Supply chain was mentioned by Ngozi. So I think here is where it's a combination of cooperation, a global cooperation. How do you use concessional funding to have certainty and to work together with the private sector? So the IFC arm, the private sector arm of the World Bank, has a health platform, and they are actually investing in manufacturing capacity dedicated for least developed countries. So I think this is actually an area where we all need to come together to make sure that we can have fair and equitable access to vaccines now, as well as obviously in the near future for future pandemics.
Thank you very much, Mari. And I would like to thank you all for such an insightful discussion.
Namaste, I'm Shilpa in New Delhi, and you're watching the World Bank Group IMF Spring Meetings.
Now we are nearly at the end of the final public event of the 2021 Spring Meetings. We hope you've enjoyed all the sessions this week, and a reminder that you can watch them all again at live.worldbank.org. You can also continue to share your feedback on anything you've seen or heard using the hashtag #ResilientRecovery. And there's much more to come. In just a minute, we'll be joined by Paul Blake, who is live in the World Bank Group's headquarters in Washington, D.C. He'll have the results of our poll, and he's also joined by the World Bank's Vice President for Human Development, Mamta Murthy, and Stephanie von Friedeberg, the IFC's Senior Vice President of Operations. They'll be taking your questions and sharing their thoughts on a fair and broad vaccine rollout in developing countries. But first, we're going to end this session with a very special performance. Petit Tonton is an actor, director, storyteller and writer from Guinea in West Africa, and he's composed a tale just for this occasion. Now over to you, Petit Tonton.
Gloire à Dieu, gloire aux ancêtres. Les anciens disent que l'espoir est le pilier qui maintient le monde. Distingués invités, permettez-moi de vous conter une histoire de mes histoires. L'histoire de l'hyène qui ne se nourrissait que de viande. Un jour, elle goûta à la volaille et prit la ferme décision de ne manger que ça. Ainsi, l'hyène tua beaucoup d'oiseaux et finit par faire disparaître presque toute l'espèce. Un jour, elle se promena dans la brousse et ne vit aucun oiseau. Elle se réfugia alors à l'ombre d'un grand arbre pour se reposer. Soudain, qu'est-ce qu'elle entend dans les feuillages? Des cris de chèvre. L'hyène sauta en ces termes: Dieu Tout-Puissant, qui peut faire monter une chèvre dans un si grand arbre? Mais se rappelant la promesse de ne manger que de la volaille, elle se détourna de cette réflexion et s'endormit. Quelques instants après, les cris de chèvre reprennent de plus belle. Ce qui poussa l'hyène à s'interroger en disant: je sais que les chèvres peuvent grimper des arbres, mais des arbres de cette taille, d'où peut venir cette mystérieuse chèvre? Elle s'endormit encore. Un troisième cri de chèvre perturba l'hyène dans sa sieste. Elle se leva et voulut en savoir davantage en levant la tête. Mais que vit-elle? Un gros coq posé sur une branche. Et l'hyène lança au coq: et toi, volaille, descends que je te mange. Et le coq de répliquer: je ne descends pas aujourd'hui, je ne descends pas demain. Toi, volaille, j'ai mangé ton père, j'ai mangé ta mère, descends ici que je te mange. Je ne descends pas aujourd'hui, je ne descends pas demain. J'ai mangé tes cousines, tes cousins, je ne descends pas aujourd'hui, je ne descends pas demain. J'ai mangé tes frères et tes sœurs, je ne descends pas aujourd'hui, je ne descends pas demain. J'ai mangé tes voisins, tes congénères, je ne descends pas aujourd'hui, je ne descends pas demain. Mais toi, volaille, je ne te comprends pas. Je viens de te dire que j'ai fini tout chez toi. J'ai mangé tout ton espoir. Oups! Dès que l'hyène prononça cette phrase, le coq sauta de la branche et vint se poser devant l'hyène. Eh bien voilà, tu as gagné. Il ne te reste plus qu'à me manger moi aussi. Cette attitude troubla l'hyène qui domina sa faim et demanda au coq pourquoi cette décision subite. Et le coq de répliquer: toi, hyène, il y a des gens qui n'ont pas de père. Ils vivent, n'est-ce pas? Il y a des gens qui n'ont pas de mère. Ils vivent aussi. Il y a des gens qui n'ont ni parents ni amis. Ils continuent à vivre. Mais quand on n'a plus d'espoir, il n'y a plus d'issue. Et puisque tu as fini de manger tout mon espoir, il ne te reste qu'à me manger moi aussi. L'hyène réfléchit. Elle se dit qu'elle qui se promène dans la brousse toutes les saisons, elle n'a jamais pensé fonder son espoir sur quelqu'un ou quelque chose. L'hyène décida alors de prendre le coq comme espoir. Et c'est depuis ce jour qu'à l'approche du jour, le coq avertit l'hyène. Et c'est depuis ce moment que l'hyène ne mange plus le coq. Tout ça pour vous dire, distingués invités, que depuis l'apparition de la Covid-19, causant d'énormes pertes en vies humaines et des crises sans précédent dans tous les domaines, le monde entier fait face à un sentiment commun: l'incertitude. Dans notre situation, l'espoir devient la seule chose à laquelle l'humanité s'accroche pour résister, pour survivre. L'unique raison qui nous maintient et qui nous permet de nous lever tous les matins et de dire que tout ira bien, c'est l'espoir. L'espoir qu'un jour, le vaccin sera accessible à tous. Et j'ose espérer que c'est ce qui marquera le début de la fin de cette pandémie. Que la bénédiction des ancêtres soit sur nous.
And a warm welcome back to the World Bank Group headquarters here in Washington, D.C. Over the next half hour, we'll be answering your questions submitted online, revealing the results of today's poll, and much more. But first, we've received a special message from His Holiness Pope Francis, and we'd like to share a few extracts from his letter. It is my hope that your discussions will contribute to a model of recovery capable of generating new, more inclusive and sustainable solutions to support the real economy, assisting individuals and communities to achieve their deepest aspirations and the universal common good. We especially need a justly financed vaccine solidarity, for we cannot allow the law of the marketplace to take precedence over the law of love and health of all. Here, I reiterate my call to government leaders, businesses, and international organizations to work together in providing vaccines for all, especially for the most vulnerable and needy. Relieving the burden of debt of so many countries and communities today is a profoundly human gesture that can help people to develop, to have access to vaccines, health, education, and jobs. This is just a sample of what the Pope had to say. You can read the full letter on our website at worldbank.org/Pope Francis message.
I'm Luis Osorio Flores in Washington, D.C., and you're watching the World Bank Group IMF Spring Meetings.
And joining us now for a live discussion is the International Finance Corporation's Senior Vice President of Operations, Stephanie von Friederberg, and the World Bank's Vice President for Human Development, Mamta Murthy. Ladies, welcome to you both.
Thank you, Paul. Good to be here.
I have a bunch of questions, and people have sent in a bunch of questions about vaccines, but first, can I just get a few thoughts from you guys? What stood out from you from the Pope's message? Stephanie, why don't you kick us off?
Wow. Paul, I have to say, it's such an honor to have one of the world's most well-recognized spiritual leaders weigh into our conversations. It really tells me that we need to think differently about partnerships. They need to be conventional and unconventional to get us out of this crisis and have a more equitable, greener world. You know, Pope Francis said we need wise solutions. And with limited fiscal space, the only way we get those wise solutions is with the private sector. And I really believe that IFC and the World Bank Group are super well placed to help spearhead that.
Thank you. And Mamta?
Pope Francis said, love and health for all. That is such a powerful and profound message. He also said something about ecological debt. He said we owe a debt to the planet. And that made me think about the fact that the infectious disease that we face today actually sprung from animals to humans. And it's driven by things like urbanization, by agriculture, by mining. So his message is really telling us we need to think about how we go about development if we want to protect ourselves and protect our planet. So really, really meaningful message.
Well, thank you both. And let's jump into some of the questions we've received from folks online. Mamta, the first question comes from Flora Fonseca in Brazil. She sent this video.
Hi everyone, my name is Flora Fonseca, I'm from Brazil. And here's my question. Could you please let me know the objectives of the global vaccine campaign?
Thanks to Flora for sending that. Mamta, what would you respond to Flora there?
So there's a very simple answer to Flora. The purpose of the global vaccine campaign is to save lives and to help everybody get back to work, get back to school, and get back to the life that they had.
And seeing friends and seeing family.
Exactly. And it's not straightforward because you need vaccines and you need to get those vaccines into people's arms. Now, at the World Bank Group, what we're doing is we're making financing available for the manufacturing of vaccines, and that falls under Stephanie, and for the purchase and deployment of vaccines, and that falls under me. It's not a straightforward business. You've got to manufacture the vaccine, you've got to transport it, you typically have to keep it cool, and then you've got to get it to a good, clean clinic that people want to go to, and then you need to record the information that they've received the vaccine. And so that's a whole process. And what our resources are doing is they're helping countries purchase the vaccines and distribute the vaccines. We have a big facility, it's $12 billion, it's a lot of money, so that countries can actually get the vaccines and put them into people's arms. And we've actually committed a fair amount of those resources already, including in countries in Latin America, in Flora's neighborhood.
It's a really kind of complicated process to get those vaccines in people's arms. And Stephanie, the next question comes from Sammy, and they're writing on World Bank Live, and they say, how are we going to ensure that those without proper access to healthcare, either due to physical constraints or financial constraints, will get vaccinated? And how can institutions like the IFC help ensure access to vaccines for everyone, everywhere?
It's a good question, Paul, and it's a really hard question to answer. First of all, I would say globally, it's a race against time. The faster that we inoculate humankind, the less likely it is that some dangerous variant of the COVID virus emerges. So we are in a race against time. And it gives me pause that of the 400 million or so vaccines that are in circulation, 90% of those have gone to the high-income and middle-income countries. There's 36 countries today in the world that haven't received one dose of vaccine. Right. So what can IFC do about it? I think we learned very early in the crisis that the private sector was needed and really needed to step up. And we saw it first in medical supplies. So there was a shortage of equipment, there was a shortage of PPE, there was a shortage of pharmaceuticals like therapeutics. We saw, for example, in the Central African Republic, there was 3 ventilators. I mean, to put that in comparison, there's 275,000 ventilators in the United States. Right. So what did we do? We created a global health platform. We worked together with our board to come up with a unique, one-of-a-kind platform, $4 billion, for us to invest in equipment, PPE, things like that. And at the very tail end of those conversations, we tacked on vaccines just in case. And then we started to see the need for increased production of vaccines globally, and especially for our countries of operations. And interestingly, as Mamta said, it's complex. So it's not just the vaccine itself. It's the cap and fill facilities. It's the raw materials that go into making a vaccine. I mean, remember, we have never tried to inoculate the entire planet as fast as we are right now. So what we're seeing is breakages across the supply chain everywhere. There's shortages of vials. There's shortages of needles. There's shortages of sterile saline. There's shortages of storage bags. So we're using our global health platform to invest in all of those things. As an example, very recently we invested in a company called Biological E. So BioE is a pharmaceutical company in India that makes vaccines. And through our facility, they were able to increase their production and will now make Johnson & Johnson vaccines for the world, which is a great vaccine because it requires 1 dose and it doesn't require as much cold storage. So very cool. They're also working on their own vaccine, which is going to be really low cost and will help us get more vaccines into people's arms. And then the third piece that we're working on is distribution, because just like we were sort of hit with the shortage of equipment and then hit with the shortage of vaccines, as these vaccines come into production, we've got to find the most effective, efficient way to get them distributed. So we've released an RFP. And it's really a competition of sorts to say,
where you ask people to send their ideas.
Send your ideas. Give us the most innovative idea to get distribution out as fast as possible. And I'm really excited to see what we come up with. Then we're supporting companies like Imperial Logistics, which is a South African company that's building a network of clinics and nurses across Africa. So there's just so much we need to do. But, you know me. If there's a silver lining in all of this, one of the things that I think is most important is we've really shown a light on the need for technology transfer into our countries of operation. We need to ensure that going forward, emerging market countries can produce their own vaccines and create better health systems for the next pandemic.
And thanks to Sammy for sending that question. The next one comes from Basadi Tamplin, and they're writing from Botswana, and they ask, how can the international community ensure vaccine governance so that there's an equitable and ethical distribution of COVID-19 vaccines? Mamta, what would you tell Basadi?
I would say that there's 2 aspects of equitable distribution. There's distribution of vaccines across countries, and there's distribution of vaccines within countries. Let's start with the within countries. Within countries, there needs to be a plan which prioritizes who's going to get the vaccine first. And at the World Bank, along with WHO, we say it should be healthcare workers and people who are the most vulnerable and are likely to get infected, and there can be death after that. Mm-hmm. It's very important that this plan be transparent, that it be known. And this plan then needs to be monitored. And this is where civil society, the media, and so on come in, because they can then follow whether things are going according to plan.
Some accountability.
Exactly.
Yeah.
And the private sector is very important for distribution. Many countries have discovered that they aren't set up for the public sector to do this on its own. Now, what we've said is that under our projects, it's very important that governments announce these plans, these are transparent, and that these are monitored. So let me give you an example. In the case of Lebanon, which we are supporting, we have the International Red Cross and Red Crescent Society that is actually monitoring the government's vaccine distribution plan. And in fact, they did step in when they discovered that vaccine distribution wasn't going according to plan. And so the system actually worked. That's just within countries. Now let's come to across countries, and that's the issue that Stephanie was referring to. Unfortunately, we're in a situation where the majority of vaccines that are being distributed at the moment are being distributed in rich countries, and we're not safe until everyone is safe. And that's why at the World Bank Group, we've been advocating for fair distribution of vaccines across the world. And we've been raising this at the highest level. We raised it with Pope Francis, and we got this excellent reply from him. So in addition to advocating for, along with other agencies, for equitable distribution of vaccines, we have also been supporting manufacture, because regionally distributed manufacture is another aspect of having vaccines for all. And finally, if I can just say, while we're talking about this pandemic, we mustn't forget that we could have another pandemic coming around the corner. And this is where I want to tie it back to this point about ecological debt. I think the best vaccine for future pandemics is that we manage the resources of this planet well. Right? And we think about how we're urbanizing, how we're doing agriculture, how we're doing mining, because essentially we're living cheek by jowl, if I can say that, right, with animals from whom we're getting all these infections. So if we manage the planet's resources and we manage development well, we will have a vaccine against future pandemics.
And you're talking about the future there, and Stephanie, just as we wrap up, looking ahead, when we've spoken in the past, I always think of you're someone who's a big proponent of technology for development. Looking ahead, what role will technology play in not just the climate part and the ecological part, but strengthening healthcare systems in countries?
Paul, you know me too well. If there's a second silver lining, it's technology. Right. And I start with the virus itself and the vaccine. And I need to look no further than programs like Warp Speed, where we were capable of creating a vaccine in 9 months. Right. And what makes me most excited about it is the new technologies that we're using. The mRNA technology, in my view, gives us the opportunity to look at the vaccine landscape and ask ourselves, can we actually tackle the 20 or 30 viruses that have plagued us? Think about a virus for Zika. Mm-hmm. So vaccines is the first place. The second place is telemedicine. I mean, telemedicine has exploded as a result of the virus. And we see, for example, in the United States, there's one doctor for every 385 people. In Africa, there's one doctor for every 4,220 people. Holy cow. So we can use telemedicine to help solve that problem. We estimate that it'll grow at a rate of about 19% a year coming out of the crisis, and even faster in emerging markets. We have a clinic that we've invested in Mexico that actually has diabetes clinics, all done now via telemedicine. One of my favorite companies in the world is this little company called TriCog, which uses AI and telemedicine to take care of cardiovascular diseases in India. And actually, since they started, they have saved 170,000 lives.
That's incredible.
It's incredible, huh?
Yeah, that's really
And then
incredible.
finally, there's drones, Paul. And again, we've talked a bit about distribution of vaccines. Companies like Zipline can help us with that. And we estimate that you can save as much as 50% of the cost of distribution by using drones. So tech by tech, I really believe we can make the health systems of the world better.
Fantastic. Well, this has been a great conversation. I'm really grateful to both of you for taking the time today. Stephanie van Vredenburg and Mapta Murthy.
Hi, I'm Vika in Fiji, and you're watching the World Bank Group IMF Spring Meetings.
Well, let's get the youth perspective on vaccines. For the past few weeks, we've been receiving videos from youth leaders, thinkers, and activists from around the world. And today we hear from Aramutha in Nigeria, Rima in Jordan, and Deepasri in India.
Educate. The youth must create awareness responsibly and accurately about the effect of the pandemic on physical and mental health and the rules to be followed.
Young people have the ability and the creativity to come up with the new solutions that could be targeted for solving social problems or serving the community.
Governments require both support and criticism on their policies for recovery, and the youth can offer both using all the platforms at their disposal, especially social media.
There are lots of myths and misconceptions about the COVID-19 vaccine. So in my own opinion, if these youths are actively involved in the COVID-19 vaccine distribution and administration process, they will act as peer influencers, providing relevant information that will debunk these myths and misconceptions, thereby promote youth compliance on the acceptance of this COVID-19 vaccine.
The youth has the time and the energy to come up with ideas and mechanisms to help us recover and rise stronger.
Well, joining me back on set is my colleague Srimati Sridhar. Fourth and final day, we've been asking polls all week. What is today's poll?
All right, Paul. So today's poll asks, what do you think is the most important factor in ensuring the fair distribution of vaccines? And there were 4 choices. First, is it increasing vaccine production to meet demand? Is it overcoming logistical challenges in storing and transporting vaccines? Is it building trust through education awareness campaigns? Or is it expanding vaccine access to low and middle income countries?
And tell us how people voted.
All right, well, with 43.5% of votes, the top answer was expanding vaccine access to low and middle income countries, followed by increasing vaccine production to meet demand at 28.2%. Building trust through education awareness campaigns at 16.6%, and overcoming logistical challenges in storing and transporting vaccines at 11.7%.
Yeah, I don't know how I would vote because all of these seem so
good
important.
Options.
Yeah, and I mean, I remember back talking to Mohammed Pateh, one of our health leaders here, and talking about the logistical challenges back in the fall. So, but there's so many other challenges here. It's a very complicated.
It's very hard to pick, so it's a tough one.
Well, let's do this. Let's have another country profile. All this week, we've been profiling the individual challenges and triumphs of individual countries when it comes to climate challenges and action. And today, we are going to hear from the Philippines. It's a country comprised of 7,000 islands, each of which is home to these incredible ecosystems.
Yes, and it's from the capital city of Manila that I caught up with country director Ndayame Diop. Start off by asking him what some of the nation's climate challenges are and how they're responding to it.
The location in the Ring of Fire means that the country is very highly exposed to climate change and natural disaster. So every year we have about 20 cyclones operating in the area of the Philippines, and about 7 to 9 of them would land. And when they do, they create a lot of disruptions in the economy, creating congestion, triggering flooding, and so on, and really impacting welfare of the population.
Well, let's talk about COVID-19 a little bit more. What is the World Bank doing to help Philippines recover from the pandemic?
The bank has stepped up very quickly when the pandemic started to support the Philippines respond to the COVID-19 shock. We're implementing an emergency response health project to strengthen the sort of capacity of the health sector to respond to pandemic. We're also implementing a large social protection project that is helping not only provide relief, but also modernizing the sort of social protection delivery system by making it more efficient, digitized, and capable of managing future pandemic. We're also implementing some high-frequency survey to monitor the impact of the pandemic on the household and the firms, and that this is very useful information for policy response. Now, as the world is converging toward recovery, our focus is now more on vaccination. We are supporting the Philippines on its vaccination program.
Philippines has a pretty large youth population. So what has the World Bank been doing to create new jobs and foster growth? But also, what has the Philippines been doing to build more sustainable cities?
COVID has been a very big destructor of jobs. A recent survey shows that 40% of the population of workers have either lost their job or are experiencing reduced income. So to really recover fully on the job side, it will be really important, number one, to successfully roll out mass vaccination for the large part of the population. Secondly, to really support the private sector to grow going forward. And then finally, to support infrastructure to really get the machine of growth going again. So building resilient cities will require more investment in low-income housing, more investment in urban transportation, and maybe green transportation going forward, and disaster risk management, and investment on climate issues.
So let's keep talking about this, because the other two areas that I wanted to focus on as it relates to bouncing back and recovering are agriculture and fisheries, and they're both a huge source of livelihood for the Philippines. So what role have they both had in helping the country bounce back from the pandemic?
The fisheries and agriculture sector still absorb almost 25% of the labor force. For these sectors to contribute to the recovery, that will require really a modernization of agriculture. The government has a very good program to modernize agriculture, to diversify agriculture, and to make the rice sector more efficient. I think that's a very good program, and the bank is supporting it. And the bank has in its pipeline rural development project, fishery development and coastal resilience project that are actually potentially helping those, will potentially help those sectors to sort of grow and to support the recovery going forward.
Great. And for my final question now, I want to end on a bit of a lighter note. Tell me, what inspires you in your job?
Well, a couple of things. One is to see the impact of the work we do, at the World Bank. It's really gratifying to see the client achieve make some progress in difficult areas. The second is, just seeing some of my more junior colleagues grow. And then finally, a great source of inspiration for me is just being in Asia, right? Look, I moved to Asia in 2012 from Washington and never left. Ever since, I've been living in East Asia and working in East Asia. And being here is not only enriching personally, but it's inspiring, and it gives me hope, because these are countries, and I'm from Senegal. I grew up in Senegal, and these are countries that had similar levels of development as Senegal in the 60s or many African countries, and to see how within a generation many of them have transformed themselves, reduced massively poverty, and create this sort of massive middle class is very inspiring.
Well, we are so happy that you were able to join us here today. Thanks so much for taking the time to tell us more about the World Bank's role in the Philippines.
Thank you very much.
And that was Ndiame Diop, the country director for the Philippines, Brunei, Malaysia, and Thailand.
Hello, I'm Shigufta Sharia in Dhaka, Bangladesh, and you are watching World Bank Group IMF Spring Meetings.
Well, Shri, let's check in on the social scene now. I know you've been talking to our social media moderators. What are they telling you?
Yes, Paul, just spoke to them. There's a lot of great conversation online today. A lot of folks online saying that global solidarity, cooperation, and coordination will be integral to distributing the vaccine, and that equitable distribution of the vaccine to the poorest countries in the world is critical for the future of global health, human capital, and also economic recovery. The hashtag has been mentioned over 2,000 times all around the world, and especially we have folks in countries like India, Spain, Nigeria, Switzerland, the the UK, France, and Canada all joining in.
Fantastic. Thank you all for contributing to the conversation and for joining us today. Talk to me about some of the notable tweets and comments we've been seeing.
Absolutely. We have the Secretary of State for Tourism, Jean-Baptiste Lemoyne, who confirmed France's financial commitment to allow access to vaccines all over the world. And Denmark's Minister for Development Cooperation and Nordic Cooperation tweeting that now is the time to show solidarity. We also had Omar Javed in Pakistan expressed his concern about the vaccine supply in the global south. And he tweeted that he hopes that the spring meetings will help galvanize greater momentum to help solve that problem.
I'm just reading here that a lot of viewers out there are agreeing with Dr. Tedros. He's from the WHO, was in the event just a few minutes ago. They are agreeing with his comments, stressing the need for global solidarity. Ross Gilligan, Marwan Meyer, and Rosalind McKenna echoed this and also highlighted Axel van Trotzenberg's comments of the World Bank on greater fairness in vaccine access.
Yes. It's a really good conversation. We also have folks running in from Facebook and LinkedIn as well. On Facebook, we have a viewer from Nigeria who commented that everyone should have the opportunity to be vaccinated, especially the most vulnerable, like underprivileged women and also girls in smaller cities. And the conversation continues on platforms like LinkedIn. We have Rahul Jha from Switzerland who commented that overcoming challenges and meeting demands would still render the effort useless if there's limited trust.
Well, thanks to everyone out there who's commenting. And we have one more country spotlight to go for today and for these spring meetings, and we're going to go to another island nation next, and that's Madagascar.
Yes, the world's fourth largest island, home to a diverse array of plant and animal species. And it's from the capital city of Tana that I spoke to country manager Marie Chantal Uwani Ligara on how the World Bank is helping island nations address their climate challenges.
Number one, it's an island blessed with its natural and rich biodiversity. And as such, it makes it really a high destination for tourism. It's obviously a nation that has really very important comparative advantage, such as the fastest internet in the region. And that really make a few sectors really competitive, such as agribusiness. We all know that vanilla come from this country. Textile, they really export a lot of things in Europe. ICT and renewable energy. Obviously, it's an island, very vulnerable to climate change. We actually estimate that this country can actually get losses up to 100 million every year due to natural disaster. So if you combine those couple of things and you add it to the fact that 3/4 of the population live below poverty line, this is a country where the bank has its raison d'etre.
Now, to add on to what Madagascar has to offer, the country recently signed a $50 million agreement to reduce poverty amongst forest-dependent communities while reducing carbon emissions. Can you tell us more about this? Share some of the highlights of the agreement.
Obviously, Madagascar has this endemic biodiversity, which make it, I would call it, a public good for the world, right? And the second, as I was saying, Madagascar is very vulnerable to climate change. So any program to fight for climate change in this country has to be a two-way street. On one hand, how do you actually renew the natural resources, the natural endowment that serve the world, that serve Madagascar on one hand? And how at the same time can you contribute to the overall program of reducing carbon emission in the world? And that's where this 50 million agreement that we signed recently to reduce carbon emission fits squarely in that two-way strategy.
Well, it's a huge achievement, so congratulations on that. I want to pivot a bit now and talk about the COVID-19 pandemic, which has impacted the entire world. With Madagascar being a tourism-dependent economy, what are your predictions for its economic recovery?
We had, in our economic update in 2020, we had actually estimated that we will be seeing a recession for Madagascar. And unfortunately, it happened. Like the rest of the 90% of the world economies. Madagascar experienced minus 4.2 growth in 2020, which represent about 9% of loss if you compare them where they were in January 2020. We see hope in 2021. We are very cautious because we are not yet off the hood. Actually, Madagascar, as we speak, is experiencing the second wave of COVID as we speak now. So, and that will obviously affect its recovery. I see hope in the vaccine. Madagascar has now joined COVAX facility. This is really a good way, I believe, of putting life of people first and start preparing to reopen the economy and to receive tourists.
Now, before I let you go, I would love to hear from you on what inspires you and gives you hope in your job.
This is really an interesting question, but you know what? I started my life in a field office. I spent 16 years in Washington. It's feel home to be back in the field. It's feel home to be in front of the client, thinking with the client, trying to help them to resolve the problem in real time. What a joy to be part of this journey of the bank, where actually you can take $100 million and transform the life of millions of people. But more importantly, when you see the life of people, how you transform the life of people, that's a mission to die for. And I would conclude by one thing. Obviously, I'm talking to a woman, and I'm a woman. And one of the things that give me hope in these countries are those women. Despite the high level of poverty, I see them fighting like no yesterday. And I feel the bank has to be on their side because no single country has been able to develop if you leave your 50% behind. And Madagascar has more than 50% of women. So every day, Shri, I come to the office. Every day I do anything, I'm looking at those faces, those smiling face of women.
So inspiring, Marie Chantal, and we are so glad that you joined us here today to tell us more about the World Bank's role in Madagascar.
I'm Eric Keglan in Lomé, Togo, and you're watching the World Bank Group IMF Spring Meetings.
All right, well, it's hard to believe, Shri. We've basically reached the end of the Spring Meetings public events. I know, it's flown by. But if anyone just joined us today or is joining us late, remind everyone maybe what they missed through the week and how they can watch it back.
Sure, let me give you a quick recap, Paul. We started off Tuesday with our event on economic recovery and its role in helping countries build a green, resilient, and inclusive future. Wednesday, it was all about debt and how countries can finance for the future amid crisis. Thursday, the focus turned to climate and how systems are changing for people and planet. And of course, today we wrapped up talking about vaccines for developing countries. And if anyone missed any of this, you can go to our World Bank YouTube channel, catch all video replays, as well as on live.worldbank.org.
Yep, all the details on live.worldbank.org. You can subscribe to our YouTube channel and never miss a thing. Shri, it's been lovely working with you all week.
It's been great working with you, Paul.
Thank you so much. And thank you to everyone out there who's joined us both today and throughout this week. We've thoroughly enjoyed receiving your questions and comments online, seeing the results of your poll responses and more. If you found our events this week interesting, be sure to check out our other programming throughout the year on World Bank Live. We regularly host conversations with top economic and development thinkers, researchers, experts. I hope you'll take a look. But for now, from us here in Washington and the rest of the team around the globe, thank you so much for taking the time to be with us this week. And until the annual meetings in October, goodbye.